Good afternoon. Good afternoon, delegates at home and here present. My name is Moriam Dejag. I'll be anchoring this session with Dr. Ejike, who is the Chair LOC, Chair Technical Management Committee, and also the CSO focal person for NFP 2020 in Nigeria. Today, we'll be talking to cross-section of donors who are generously supporting our family planning programs at the national level. If we go on memory lane, we see that enjoy from early 1970s. Nigeria was the mostly and formed by a group of physicians well in Lagos then. Sorry. Hello, hello. Sorry, change the mic. This mic is not functioning well. So the number of donors over the years have increased and have included United States Agency for International Development, the Foreign Commonwealth and Development Office, the government UK aid, the Bill and Melinda Gates Foundation, Global Affairs Canada, the Ford Foundation, MacArthur Foundation, Packard Foundation, United Nations Population Funds. We also have Williams Hewlett, MSD for Mothers, and a host of others. Areas around policy dialogue and formulation, procurement supply management, service delivery, which included training of service providers, equipment procurement, renovation of facilities. Also, they've been involved in social and behavioral change communication, community mobilization. Though we can say that the funds have not covered the entire nation and not statewide in some instances, but it has been catalytic and is meant to facilitate activities, across the nation. Also, they provided funds for procurement of commodities, and in some instances, for pilot study and proof of concept, which has aided internal validation and subsequently scale up of some activities across the nation. It has been very visible and has served its purpose and supported in shaping our health system to some extent and delivering of products and solutions. This was at the backdrop of the ever first International Conference on Population and Development 1994 that we had in Cairo. Committed to support. Tickets were set for donors at the conference way back then. Also, we had the same commitment that was set when we had the London Summit in which 69 countries came together to make commitment to reach additional 120 women with right-based family planning quality services. Also at the London Summit in the two instances, donors also made commitment to support countries to be able to reach their targets. Nigeria, which was very responsive, when we came back after the first London Summit, we set our target to 36% contraceptive women for married women. At the second had in 2017, we came back and the target was set to 27% for all women. Then when we research into the literature, according to the Journal on Health Policy and Systems Research, an estimate of about 400 to 88 million dollars has been spent by donors across countries. And recipients of the 10 largest disbursements in aggregate of 11 years included Nigeria, apart from 10 other countries. And with our collaborative efforts with these donors, with the funds that have been given to us, we've been able to reach over 5 million women with contraception since 2012. Today, we want to put Nigeria in the center stage and have a friendly conversation from perspective of donors on how we have fared so far. Here present that are online, we have Ula Mula, who is the UNFPA representative to Nigeria. Ula Mula, welcome. And also we have Chris Pycroft, who is the Development Director, UK Foreign Commonwealth Office. Chris, welcome. And Paul Macadot, who is the HPN Director, USAID. And last but not the least is Ms. Yabdoni Olubode, the Nigerian Director for MSD Mother. For MSD Mothers. Good morning. Okay, and so, okay, represented by Paul Macadot is represented by Ebere Anyanchukwu, who is the program advisor for UK Aid. Thank you for joining us today in discussing the family planning landscape in Nigeria. You're most welcome. Now, to continue, I'll want my co-chair to say one or two words before we continue. Dr. Ejike Oji, please welcome him.
Thank you very, very much, Miriam. I joined Miriam to welcome and thank donors who have been supporting us to be in this session. Moving forward, we would like to, this particular session is just to have a conversational interaction with donors to be able to know how, as they have been supporting us, work collaboratively to be able to get to a more sustainable way in funding our family planning services that are right-based in our country, to be able to go from demographic crisis to transition and dividend, so to speak. So I would like to start by asking whoever wants to go first in answering the questions in terms of the interaction. I would like to ask, what are your perceptions of the Nigerian family planning landscape? What's your perception of the Nigerian family planning landscape? So I don't know who would like to take a shot at it. Maybe Paul, Ebere, can I start with Ebere Anyanchukwu of UK Aid? Ebere, are you there?
Yes, I'm here.
Okay, Ebere, we would like to welcome you and thank you so much for finding time to be here. We are grateful you were with us yesterday. So please, if you don't mind, if you can kickstart this session from your side.
Okay, thank you very much. I'm representing Chris Pycroft, the Development Director for FCDO, who had planned to be here today, but had to be called away at short notice, is unavoidably absent. So thank you very much. Yeah, in terms of what we think about Nigeria's family planning landscape, essentially, I mean, it's the same things that we've been discussing in this conference throughout the week. Basically, that's well, there have been a number of there has been a lot of progress over the decades in terms of the delivery of family planning, but in terms of the actual use of family planning, like the contraceptive prevalence rate, the improvement we have seen has not really, it's nowhere close to in terms of contraceptive prevalence rate, in terms of reducing the numbers of people who want family planning but are not able to access it. So we have a long way to go of addressing family planning. And also, this is really important because it's critical to Nigeria's development. I mentioned the other day when I was at the conference, family planning is critical to women's empowerment. It's critical to get the demographic transition, which is also critical to lifting millions of our people from poverty. So we think it deserves a lot more attention than it is currently getting. Not just for the demographic side, but also because of the health of women and children. We know that it is those women who are not able to access family planning who are more likely to die in pregnancy and childbirth. And we know that it is their children who are also more likely to die as infants and children before their 5th birthday. So it's absolute, and I think over the course of this week, we've discussed in a lot of detail around what the problems are, so I don't have to go into them and how we can begin.
Okay, Barry, are you still there? Yeah, looks like. Thank you, Barry. I'm sure we'll get back to you with some more proposals that we have
around what the problems are.
Okay, Barry, it looks like you're a bit. Okay, so I would like to thank you very much for your inputs on this. I would like to go on to Paul McDermott, if he is online. Is Mike with us online from USAID?
Good afternoon. I hope everyone can hear me. Thank you, sir, for the introduction. This is Paul McDermott from USAID's USAID Nigeria mission. I'm the director of the Health, Population, and Nutrition Office. And if people are having trouble hearing me, let me stop right here and see if that's the issue.
No, we're hearing you, Paul. Thank you for joining us. We're very grateful. So I want to ask you the same question I put to Ebere, which is, what's your perception of Nigerian family planning landscape?
Thank you very much. Before I start, I should probably highlight just one or two things, since I have the microphone, about the family planning landscape. We heard a lot, and Ebere mentioned it during this week. I was specifically or notably impressed by the real notes of concern that came out from the Honorable Minister of Health Minister of State for Health, Dr. Mamora, in his plenary remarks, in which he talked about really an economic time bomb that is what we're faced with growth, some of the modeling that shows the growth at 3%, and making that the scenario, a very likely scenario of Nigeria being the 3rd most populous country in the world by 2050, with 400 million people, and the dire impacts that would result if there's no concomitant economic growth and social and economic development and health systems that emerge to handle the immense pressures that would result from a country that looked like that. So I think it's, if you want to ask USAID, we are helping more than 225 million women worldwide who want to avoid pregnancy and are not using a modern method of contraception. And so just increasing the access to reproductive health services, including voluntary family planning, will have profound health, economic, and social benefits for Nigerian families and communities. And the funding that USAID has devoted to Nigeria for many, many years comes from an office called the Office of Population and Reproductive Health. And it sits within the Global Health Bureau at USAID. And it is allows us to say that we are the world's largest family planning bilateral donor. And we're committed to helping countries meet their family planning and reproductive health needs. And our work in reproductive health in Nigeria focuses on a number of areas related to the family planning landscape, including ending child marriage, female genital mutilation and cutting, services for fistula repair are soon going to be available. And then gender-based violence, of course, which has been a huge problem related to COVID-19. So I think the first thing I would say is that if you start with the most vulnerable people who are affected by the landscape in Nigeria and family planning, you would look at the victims of those most vulnerable to COVID-19, those most vulnerable to violent conflict. For example, folks who are in the Northeast, in the Northwest, and other parts of the country where there have been some tremendous impacts on health services of COVID-19, but I think even more chronic impact of conflict on the delivery of health services. I think for the USAID's perspective on this, it's helpful to look a little bit at the other vulnerable groups that we're trying to work with in places like Lagos and Kanu, with the launch of the youth-powered adolescent health engagement program, which was launched, will soon be launched, but we actually started implementing it already in these two states. Because youth are constantly asking for a little bit more help to get access to advice, services, and yet there are, in this country, there are many obstacles to that, and a lot of them are related to cultural and social issues. Some of them are even legal. So I think there are opportunities when I look at the possibilities to galvanize or mobilize advocacy on what's needed in the country. I think there's an awful lot of goodwill. I think there's a sense of disappointment that year after year we don't see the kinds of procurement and distribution of contraceptives. The contraceptive security of the country is extremely low from what you would expect, and the answer to it is quite simple: release funding that can be used to procure and make available contraceptive services and commodities, because I think, as we all know, that there are millions and millions of women in Nigeria who've already decided that they want to avoid pregnancy and they want to adopt a method of family planning, but there's stockouts wherever you go. I think there's a great number of service providers too who would be quite happy. They're very well trained and ready to provide services. But I think that one of the big weaknesses, one of the easiest ways to address this gap would be timely release of funding. And of course, USAID is also going to be very helpful to those who are involved in procurement to make sure that quality issues are addressed, marketing issues are addressed, and that there's a huge involvement of women who are also, I think, victims of a lot of marginalization throughout the world, but in many parts of Nigeria as well, where we don't have much gender equality, which we can point to as a underlying theme, but that also contributes massively to impacts on low demand and low availability of family planning services in the country. I would say that I'm profoundly grateful to hear the statements by the Minister of State that they plan to be committed to deliver an increasing amount of resources and attention to this problem. And I'm encouraged to know that that USAID stands ready to support all the other donors that are working in this space. I know the EU is working in this space, will continue to work in this space, the Bill and Melinda Gates Foundation, our colleagues in the UK, the Canadians. There are many bilateral donors that are going to continue to be involved. But I think we are disappointed a little bit when we see that some of the easy solutions that maybe could take a few $1 million are not being readily provided. So those would be my introductory comments. Thank you.
Thank you, Paul. Thank you very much. You deserve a round of applause. There's no doubt, Paul, that Nigeria is very grateful to the USAID. If we remember that in the 90s, when for obvious reasons you had to pull out your support, family planning services went down considerably because of the lack of that very needed support. I'm glad that you're back and doing well. And then from two of you, we could see there's some level of alignment with what the Nigerian government is thinking and wanting to do. And then also for our association that is doing this meeting or conference every 2 years, we could see from our theme and themes that we're also in alignment with both what you have said and that of Ebere. So with that, I would like to move on to Joachim of UNFPA.
No, Erica, no. Oh, sorry.
So I would like to move on to Joachim Chijide of UNFPA. My question to Joachim. Joachim, are you there? Joachim, are you there? Okay. If Joachim is not there, let me go to Iyaduni Olubode of MSD from others, yes. I would like to ask, what are the best practices you have identified within the portfolio of projects you have in Nigeria? If I repeat that question, are you there, Iyaduni? Iyaduni, are you there? Okay, she's there.
Yes, I am, Dr. Ejike. Thank you very much.
Oh, sorry.
Can you hear me clearly?
Oh, I didn't know that, Ola. I thought Joachim here. Ola, I'm so sorry. We'll come back to you, Ola. Oyedumi, my question to you, what are the best practices you have identified within the portfolio of projects you have in Nigeria?
Thank you, Ejike. Can you hear me?
Yes, we can hear you.
Okay. Good afternoon, everyone, and really pleased to be here. Thank you for the platform. MSD for Mothers is a private sector initiative, and I think, we've speaking about, the landscape, we've definitely engaged with private sector, which is a great thing. And we believe there's still more that can be done in engaging private sector to address this challenge that we have in the family planning situation. Speaking from our experiences, I think that one thing that has definitely shown up is that we need to explore digital as a solution, as a way of helping to deliver, exploring how we can use digital systems with teleconsultations, in delivery systems, in enlightening people, health education. I can't remember who it was that mentioned this. High awareness, but low utilization. There is a gap there that digital can very conveniently help to fill. We recognize the challenges with digital, especially as infrastructure is a challenge here in Nigeria, but we shouldn't shy away from that. I think we should take on the challenge and explore how we can leverage digital technology, and we're doing that. We're supporting the Society for Family Health to do that with a digital partner, Nivi, who is helping them with reaching out to people digitally through Facebook, through WhatsApp. Another thing that I think is important is really understanding the needs of the women. And the needs of a woman in Lagos are different from the needs of a young girl in Lagos are very different from the needs of a lady in Kaduna. And so adapting to the needs and the preferences and the values, and being mindful of that and making sure that our solutions respond to those things, I think are things that are making the difference. Being able to pivot as soon as you recognize that this is the prevailing need, this is how people respond. I think we need to pay attention to what people are doing. As a third, I think an important thing as well, that and a direction that I think we should be moving in is you getting private providers covered under the universal health scheme. How can private providers be reimbursed for family planning services rendered? We need to think sustainably about providing family planning. We mentioned and talked about the need for funding. We need to start adjusting the mindset and expanding the mindset to accept family planning as part of the bouquet, and also extend that to private sector. So I think those are three things that we've been learning from our partners who are working in that space, and we think could actually make a difference and make a dent in the situation. Thank you.
Thank you, Yadumi. Thank you so much for that. There's no doubt the 67% of services are provided in Nigeria. If we're able to get the private sector on board, I'm sure it's going to have a very wonderful salutary effect on services provision across the country. Ola, are you there?
Yes, I am.
Okay, I'm so sorry before I missed you. I would like to pose the same question to you, the one I posed to Yadumi, and that will be, what are the best practices you have identified within the portfolio of projects you have in Nigeria? We also want to thank you so much that you've been with us since yesterday. That was very, very gracious of you. Thank you so much, Ola. So we'd like to hear you now.
Thank you so much. So I'll also take the opportunity. I would be happy to talk a little bit about best practices, but also want to address just a little bit about the landscape, because I think there are some issues around the landscape I think needs to be addressed. And one of them is, as Paul said very correctly, is the supply chain and logistics and procurement. However, I think one of the challenges we have is that there's too many structures to do it. So we do have a basket fund for commodities and the last mile distribution. And that is a national coverage that we do have on that. And the government contributes to that. We have a good group of donors to that. I think the challenge we have, especially when we know resources are, especially now during COVID time, are dwindling, I think it's really important we all contribute to the same system and don't build up parallel systems. And if we are very honest, also, you know, when we sit and have these conversations, there are a lot of parallel systems being built up, and I think we need to rethink how we do that. I also think we need to, when we talk about the landscape, I do think we have gotten stuck in the language. I think, and you heard me mentioning that yesterday also, I do think there's a tendency for us to focus on maternal mortality only, but not as to the why is it so important that women survive. First of all, the right to life is absolute, but there is actually a greater point in ensuring that we have access to family planning, which is about economic growth. It is about poverty reduction. It's about social growth. It's about climate. It's about every single sustainable development goal. And we need to insert that in the landscape in Nigeria so it's much better understood why family planning is so important. I think that's a major task ahead of us. So what we have that are good practices, or best practice, I actually think the last mile distribution is a very good practice because we have managed to pool funding and we work very, very closely with the government and we jointly develop distribution plans and we really try and reach it. Last mile has that name because we are trying to meet the most vulnerable. You can argue the basket isn't big enough, but and I would definitely argue for that. But I do think it's a really good example of how you have a strong co-lead with the government, where the government is hands-on at federal level, working also down to state level, all the way to LGA level on where it needs to be. I think the challenge we have with that is that the contributions do not necessarily cover transport and logistics, the supply chain. And I think that is something we need to have a conversation around. How do we make sure that is looped into what we have established works as a good practice? Because that's where I think the risk we have when we talk about stockouts, Paul, is that very often we actually have the commodities, but they are not distributed. So it's that last little bit that we need to focus on. How do we make sure it gets from the warehouse at the decentralized level out to the facility that needs it the most? I also think there are some really good practices around self-care, and we have an emerging evidence right now, especially around methodologies like Sayana Press. And I do think that is coming up and building as a really good way of expanding access. And I don't understand why we wouldn't put the power in the hands of the women. It is a woman's right to decide, and she doesn't have to go back. We don't question whether you can get do your own self-injection when you have a similar method for injection of insulin, but this is not an intravenous injection. So I think there is an emerging good, practice coming up now around rolling out Sayana Press that shows us that that's actually another way where we also then involve the private sector, because then if there is a prescription, a woman can actually pick it up in the private sector. So I think there's a lot of emerging evidence, but for me, I think the collaboration that surrounds the last mile distribution and the commodity basket really shows that it can be done. And there's a great deal of accountability in that model, because it holds both the government and the donors, whether we are multilateral or bilateral, accountable to what we have promised. So transparency is very high, and I think that's important too.
Thank you very much, Ola. Thank you so much. I think there's a community of, should I say, how you have assessed the last mile concept issues like stockouts. I'm sure we'll be able to talk more, a little more about that later. I'd like to move back to Paul. Paul, I would like to ask you, what are the identified gaps that can be improved on? What are the identified gaps that can be improved on? Paul, are you with us? Okay.
Paul, would you unmute? You're still muted, Paul. You need to unmute.
I'm sorry about that. Thank you. So no, I think my colleague from the UN Family Population Fund really hit it on the head, that there are some frameworks out there, and I think that, as was mentioned, when you have a framework that does hold each of the stakeholders accountable, it really is a powerful tool. It kind of forces you to stay on the path, and with regular dialogue about the data that we all have access to. I think that makes it even easier to sort of hold each other accountable. So I think that's a very good point. And I think some of the frameworks in which the state level authorities are addressing their own accountability is also very important. And so while we focus on the federal level and the last mile distribution at the state level, let's not forget about how the growth of the states in terms of their access to finances for health is improving, in terms of getting people on coverage for health insurance in many states is improving, in many states it's still lagging. I think there are opportunities that will become greater as the financing problems resolve. And I was very encouraged back in August when I saw that the NPHCDA had released so much funding through the Basic Healthcare Provision Fund. But I also kind of raised a question for me as to how much of that basket of funds that went out to the states went to cover actual family planning parts of their annual operating plans, because I know every state has one. And each one of those plans many states is supported by many of the bilateral and multilateral donors that are here today. So those are opportunities and those are tools to fill gaps. And I think that addresses one of your questions. I think there's another gap in the level of cross-sectoral coordination. And here I'm talking about the education sector mostly, but there are probably many others where you could have, instead of just the health sector doing all that they can to address the gaps in family planning, could perhaps create some synergies with the education sector, because that is a very powerful platform for addressing the needs of the youth that I mentioned earlier. And also, there are resources in the education sector that might be of synergy with the health education goals that are required for family planning services to meet their targets. I'll stop there because I know that there's people who are much better equipped than I am to go into some details about the gaps, but I just wanted to hit those couple of high notes. Thank you.
Thank you very much, Paul. Thank you so much. Let me quickly now go back to Ebere then. Ebere, I'm sure you're still there with us. We would like you to also look at, because you have a lot of varied IPs that work with you, and I'm sure you will be able to throw more light on this also. What are the identified gaps that can be improved on?
Thank you very much. Yes, in terms of gaps, in addition to the ones Paul has mentioned, of course, you always have to talk about the financing gaps. As you know, there is a basket fund, and every year we all struggle to make sure that there's enough money in that basket to deliver the commodities that people need. But it's not just about the commodities, but it's also about the resources to get these commodities to the people that need them. And over in the last few years, we've had serious challenges where we've had actually commodities, but no resources that budgeted and planned to actually deliver them. And what we're encouraging Ministry of Health and others is if you are planning for commodities, you should also plan for distribution. There should also be so if you are planning $4 million a year for commodities, you should also plan a certain amount to distribute those commodities down to the last mile. It's really important. So that's one gap. Apart from the gap in the actual commodities itself, there's also a gap in the health system delivery system, and I think this is fundamental. In numbers of health facilities that have the ability to deliver these services, there's also the health workers themselves, health workers that are trained to deliver particularly long-acting methods, and also the way that we link with the private sector and how we engage with the private sector as a channel to deliver family planning, and also gaps in how we finance things like consumables, which people are typically asked to pay for, and which act as a barrier to access to services. So those are just some of the areas that I think we need to look at as well. Thank you.
Thank you so much, Ebere. Moving on, I would also like any of you can jump in one after the other, but let me put this question to Iyadumi. How do you think your organization can support the actioning of the family planning blueprint, which was recently launched by the Honorable Minister of Health in October? The other one expired last year, a new one was developed and launched. So how do you think Do you think you can support us in a medium-term plan to make sure that this also goes to helping us achieve our purpose? Yeah, do me unmute your phone, your mic, please.
Hello, Dr. Ebere. Thank you very much. Can you hear me now?
Yes, I can hear you.
Okay. Yes, as a private sector organization, as a private sector initiative, we have demonstrated our commitment to supporting to achieve family planning goals. And this is why MSD for Mothers and the Gates Foundation jointly pledged at the FP 2020 conference. We recognize the distinct role that family planning has and how effective and potentially effective it is in preventing maternal mortality. And so we are committed to supporting family planning in Nigeria in furtherance of our vision to create a world where no woman has to die giving life. I can't say, I can't give you any firm commitments, but I know that we're definitely, we've definitely demonstrated our commitment through the work that we support on with the Pharmacists Council of Nigeria on the Integrity Project and the post-pregnancy family planning project. We'll definitely be looking to continue our support.
Thank you, Yadumi.
Thank
Ola,
you.
I'm sure you're still there with us, Ola. I would like to put the same question to you. How do you think UNFPA can support the actioning of the FP blueprint launched by the Honorable Minister of Health in October 2020? Ola, are you there?
I'm here, yes. So, sorry, sometimes technology, we should be used to it by now, but we're not always, I guess. So the FP blueprint, of course, is something that we in UNFPA will work closely with the government to implement. And we will do that to a very large extent, also focusing on the challenges we have in rolling out FP. I think what we have to recognize is that it's very different across the country, how perceptions are around family planning. And I also think we need to be honest, I know the federal government is very aware of this, is that the progress have actually stagnated since 2012 and 13. We haven't really moved away from the 12%. And the blueprint for family planning is going to help us because we are in a hurry. We need to get to 27% in 4 years, which means we need to more than double contraceptive prevalence rate. So that blueprint is definitely going to be critical, but we also need support from other donors in order to make this happen. And I think that are really important conversations we need to have because the challenges are huge. We heard also, as Paul mentioned, the situation in the humanitarian settings, where it's very difficult for women to access any kinds of services, and really instill that sense of urgency as we roll out the blueprint. Because I do think, transforming that into tangible plans, that's where we always get stuck, isn't it? We have a lot of policies and a lot of blueprints, but to go into each state and roll it out to LGA level and make it tangible, operationalize it, conceptualize it, and engage at local level, that is very often where we get stuck. So I think we need to really think carefully about how we do that. And I think I may have given my answer a little twist to the direction you may want it to take, but I do think we have, huge responsibility to make sure that we get better at operationalizing all the grant papers that we present and rally around. It's difficult to get policy agreement, but it is equally difficult, if not more difficult, to actually implement it. And maybe we need to emphasize more and focus more on the actual implementation and enforcement of the policies available. Something as simple as family planning being free in the country. Not all women know that. And they should not be met with provider bias and asked to pay for something that's for free when they come into a public facility. So I think, as I said, I'm probably tweaking my answer a little bit to making sure that I say some things that we think is important in UNFPA. But it's all part of the blueprint, of course, is how all the components come together in that. I think I'll pause here and go back to you.
Thank you very much, Ulla. Before I bring Paul back, I would like to ask all our audiences across the world and in Nigeria, we would like to take one or two questions anybody would like to pose to our donors. Sorry, please put it in the chat box. There's a chat box, so put it in there. So I would like to move on to cutting recommendations, and I would start with Paul. Paul, can you give us, in your own estimation of how things will go, what are the cross-cutting recommendations you think we should adopt that will make us get to El Dorado, if I'll use that word?
Thank you very much, Mr. Moderator. The recommendations, I think, have already sort of been captured in our earlier contributions. I think two of them that I can think of right away, though, is to look at the opportunities, perhaps, to roll out in the states where they don't have them the tools that I think Dr. Mueller from the UNFPA mentioned. These accountability frameworks that take the operational plans that are required at the state level and use the biannual review with all the stakeholders, private sector, civil society, not just the health authorities, but the partners, to come together and really look at the state level down to the LGA level at primary health care, including family planning. So I think that accountability mechanisms like what we have in Bauchi, Sokoto, Kebi, in terms of the memorandums of understanding, which are documents that are tools for accountability, I think are powerful. The Bill and Melinda Gates Foundations really helped advance these, and I think that they are when all the stakeholders sign up to them and make sure that these meetings happen every 6 months. I think that's powerful. Another recommendation I would recommend is take a look at the resources again. Maybe the fact that the National Health Act is going to be revised provides an opportunity for the family planning community to galvanize around and try to see if there can be more strict language, sort of the language that was put into the Health Act that resulted in the Basic Healthcare Provision Fund. Shouldn't we have similar targets of, let's say, 25% of all health budgets approved should be dedicated to family planning? If we advocate around a target like that, that might jar loose some political will. I think the third thing I would just say that we have in Nigeria a huge number of champions for change. How well are we doing as a group of stakeholders in family planning to really leverage the interest of political leaders, religious leaders? There are big names out there. The Dangote Foundation has a lot of weight to add to these kinds of debates. How frequently are we engaging all these champions in a way that really, like for example, at this conference, we've had some big names. Are there other names we would have liked to have had here to highlight our conversations around these very important issues? Just some thoughts. Over.
Thank you very much, Paul. Because of time, I'll take one question from the audience, and then we need to look at summarizing what I've heard so far. There was a question from the audience that said, what are the international development partners doing to ensure that the Nigerian government take responsibility and stop depending on donors? Let me pose that question again. It says, what are the international development partners doing to ensure that the Nigerian government take responsibility and stop depending on donors. So I don't know who wants to take a shot at that.
Maybe I can start, and then we can also hear maybe Paul's thoughts on this. So I think what we're doing from the United Nations side and from UNFPA side is that we are talking to the government, and as you heard me say earlier, also they are also contributing to the commodity basket. So it is actually on the finance budget, on the annual budgets in Nigeria. So we are advocating and engaging very strongly, and also pleading that that the budget lines are increased. So for instance, also during COVID-19, one of the things that we emphasized and that the government made sure was budgeted was actually that family planning remained essential services. Now, you can argue whether this funding is sufficient, and with a huge unmet need in this country and the way we have to go, it needs to have a bigger priority. So we would be advocating for that as well. I would also just want to stress that a lot of the states are contributing also to UNFPA, and then allowing us to actually administrate some of that funding in rolling out the activities. So not everything is, not all funding comes from the sort of traditional suspects like USAID and FCDO, but also from the government who provide core funding, but lets the administration go somewhere else. So it can be a very smart and very efficient decision sometimes. It's going to be a long way, especially in post-COVID recovery, but it's also part of the One UN offer, is how we advocate and ensure that the priority areas are actually included in annual budgets. I know Paul probably also have some thoughts on this, and I'm sure some of my other panelist colleagues here have the same thoughts. Over.
Thank you very much, Ola. Is there any quick one from any other person?
Thank you very much, Ula. I just wanted to say that I think that this is where looking at alternative models is particularly relevant. And one of such alternative models is the Integrate E model that is accrediting patent medicine vendors to offer quality family planning. So you're managing them, you're training them, and ensuring that they meet a certain standard and are able to deliver family planning within a certain price point. We need to think about sustainable solutions, and I think that we need to be open to new models that support a sustainability end. Thank you. I thought I'll just mention that.
Thank you, everyone. And I would like to quickly go through a few of the things, and then I'll hand over the microphone to Miriam to round up this session. One of the key things that I think that resonated from all of you, of course, in terms of landscape, everybody has agreed that we have a ticking time bomb if the bomb is not here already. And then also the gender-based violence, and then the need to focus on making sure that we meet the unmet need of the youth. The other one that also resonates in terms of things that we should know how to get out of is the issue of stockouts. And then another one, it has to do with funding, procurement, and logistic issues. But one other one that resonated, especially from others, is the self-care strategy, which to me is like demedicalization of the services so that women can take it, their choices they make in their hands. The other one that came up is the importance of regular dialogue to look at accountability-related issues, especially across the federal and sub-national levels. And then one of the key things, I think Ebere mentioned, that is the major gap in the last mile distribution, and then making sure providers are able to provide back. And then in terms of major in policy and action, there are major gaps in accountability issues. Money has been voted for family planning. Does it relate to the outcome that is expected? And then, of course, there are opportunities to use a biannual accountability framework to review things, especially at the sub-national level. And then also the opportunity, the revision of the Health Act is bringing on the table to improve things about it. But the most important thing that the UN or UNFPA is doing is talking to government to make sure that they increase the budget for family planning. So these are some of the highlights that I could get, and I would like to take the microphone to Miriam to round up the session. Thank you very much.
Thank you very much, Dr. Ejike. For me, I think it's quite worrisome when you say that out of over 200 countries all over the world, we are the 7th most populous country now. And by the year 2050, we'll be the 3rd most populous country after China and India. That is quite worrisome because our population will actually be hitting about 3 digits by then. And the nexus of it all is about us actually taking up family planning services to make sure that we're able to manage our population better, thinking about going through the rights-based approach and making sure that we look at it through the lens of the woman. And also family planning, like I hear people say, it's not that it's a health issue alone. It's all about economic development. It's about reducing poverty. It's about managing employment, which are critical issues and topical issues in Nigeria, which we have found really difficult in addressing. And one thing about it is, as our population increases, because of high fertility rate, also the mortality rate also increases. What we hear people say is, no, we're not saying women should not deliver, but the health of women and the right of women should be placed forward when it comes to, women actually thinking about reproduction. Then also where we are focused on, yes, has gotten to also where we are, but a lot of focus over the years have been on the public sector. And we realize that funding about addressing about 60% of our needs in Nigeria. So how can we make sure that we actually focus in such areas? Then the recommendations that I hear you say is that, one, we have to mobilize local resources, but not just financial resources alone. Also, how can we mobilize our champions to make sure that we're able to raise the visibility when it comes to family planning issues in Nigeria? Again, when we talk about the procurement supply management chain, we should be thinking about a total solution, not a solution about just buying procurement alone, but how do we make sure it gets to the health facilities? How do we make sure that women actually have access to them? So the two things we hear about, when I come about services, is that services must get lower down there to the service delivery point, and we must find a way of the women actually accessing it. So those are the two critical solutions. And when we bring in the private sector in these days, how do we engage them? Which mechanisms do we actually use in engaging the private sector? It's not only about corporate social responsibility. It's also about how do we sit down to discuss about the mutual benefit is going to actually give to both the government and to the private sector when they think about that. So I hear us talk about engaging the private sector in a meaningful and sustainable manner, rather than giving handouts also to us. Then when we also think about it, how do we make sure that we carry the responsibility from the health provider to also the women out there, to the clients, and we talk about expanding our method mix. Sana Press, I see, resonates actually with us. How do we make sure we're able to expand the method mix to make sure that women are able to take charge of the responsibility of reproductive health in there? And lastly, when it comes to the private sector, we should also think about engaging the PPMVs and the community pharmacists in making sure that we're expanding services into the hard-to-reach areas where we know we can see this set of people. Then going beyond health, we should also think about health in a cross-sectional way. How do we engage other sectors into it and make sure that we are going in a cross-sectional way? We are thinking of a sector-wide approach in bringing other sectors into this and making sure we see actually it works. One thing I know is that, and I've heard, is that government has to continue with the leadership is providing, the stewardship, making sure that it's thinking about how does government take charge and make sure that they're able to mobilize local resources to be able to continue with family planning. We shouldn't continue with depending on donors alone, but we should stand strong and firm and make sure that we're able to provide services to the women out there. Yes, I'll stop here for now, and I want to thank people online. I want to thank Ula from United Nations Population Fund, and also Paul McDermott from USAID for being with us here today, and also Yaduni Olubode, MSD for Mothers, and Ebere Anya Chuku from DFID. We thank you very much. I think it's been very insightful listening to you, actually examining and x-raying Nigeria and providing recommendations on how we can actually move forward. It actually aligns with develop the medium-term plan, which is the blueprint that is going to move us forward. And we encourage and invite donors and more donors to join us to make sure that we actually make this work. Thank you very much to delegates at home and here, and to Dr. Co-Chair for being here with me. Till we meet again, I'll say thank you very much, and God bless you.